I received a letter from one of my patients last week, a person who has just finished up her care plan. She was with me for just over 6 months. Um, she had some really amazing and astounding results here in this office due to some of the unique things that we do. And she had been all over the place trying to get better, trying to heal herself, and was unable to do so. So she found me, and this is her letter that she just sent me. She's too embarrassed to go on camera and discuss her case, even though, you know, even though that would probably help a lot of people see things better. I'm going to read it to you. My name is Agnes. I live outside of Reading, Pennsylvania. Now, Reading, Pennsylvania is about 2 hours away from here, maybe even a little bit more. 2 hours by car. And she had been a patient of mine for 6 months. We do treat patients, in lots of other places, some faraway places. We have a couple international patients too, one in India, one in Spain, and then we have people all over the U.S. But in either case, on my 74th birthday, I decided to change my life. I found out about Dr. Wallace from a woman who had gone to see him some years ago. Now, the woman that referred Agnes to us is her nurse practitioner. And her nurse practitioner had seen me. She had weight gain issues. She had fatigue issues, chronic pain, and some other symptoms as well. So she had gotten some really good results. So she referred her in. She told me he changed her life. I have type 2 diabetes, and my numbers were really high, even on medication. And I'm going to go over her case. I'll go over the numbers in just a minute or two after I read this. Were really high, even on medication. Also was diagnosed with hypothyroidism, with goiter and nodules. Had stomach problems, and my weight was the highest ever. I couldn't get it down. I had no energy and was depressed, and tried many other things, and nothing seemed to have worked. After Dr. Wallace received my blood test and my history, he showed me what to do. In 6 months, I lost 27 pounds, have more energy, am not depressed, and my stomach doesn't hurt. My sugar is down to normal, and my A1c is down to 6 from 9.1. My medication is cut in half, and hope I won't have to take any soon. Now I can say Dr. Wallace has truly changed my life. Thank you, Dr. Wallace. So what she doesn't tell you in here is a couple things. First of all, fatigue was a big thing for her, but the stomach pain was a major thing. Looking at her chart, she even had anxiety. She had hot flashes that were almost unbearable, caused her not to be able to sleep. Bloating, water retention, the upset stomach was a problem for her. She also had ear pain and gurgling in her ear for years and years, for over 10 years. Just a gurgling sound that was consistent and didn't stop. She had high blood pressure, diabetes, she had sinus surgery, she had surgery on her ears as well for that gurgling sound, which didn't work for her at all. Had hip replacement, and she told me when she got started that her knees, both her knees, need to be done. Those were her words. She had still had her amalgam fillings in her mouth, which she still has them, and she used antibiotics frequently. She was on 1, 2, 3, 4, 5, 6, 7, 8, 9 medications, 2 blood pressure medications, diabetic medication. She was on diuretic. She was on a antibiotic for really is meant, actually the antibiotic is meant for acne, but she uses it to prevent infection during her toenail cutting and during her dental work. She took an antihistamine, and she took a reflux medication, Nexium. And she also got cortisone injections 2 times a year because she was in such severe pain. So that's what we have in front of us here. Her A1c was 9.1 when she began. And now that we've finished up, her A1c is just under 6, 5.8. We want it to be under 5.7, so she's not quite perfect yet. But out of those 9 medications that she was originally on, she is now on 1. So 8 of them no longer taken. Doesn't need her high blood pressure medications anymore. Doesn't need her diuretics. Doesn't take her antibiotic anymore. Doesn't need her her GERD medication. Um, doesn't take the antihistamine. And because her pain is decreased so dramatically, she doesn't feel like her knees need to be done, and her cortisone injections no longer need to be taken. Now, with that, I didn't do any physical modalities to her at all. We didn't do any physical therapy, no chiropractic, no acupuncture. This was all metabolic work, and also some homeopathic, some bioresonance, unique bioresonance work that we had done with her. So when we go back to look, one of the main things that she had to deal with was some toxins and pollutants. I call these things splinters to her health. So if you imagine having a wound on your arm and you have a splinter in there, and you go to all the best doctors, and the first doctor gives you an antibiotic cream, the next doctor gives you the newest and best and better antibiotic cream, and then you find a new bandage, and someone has a laser, and someone has all these other things. They're trying to fix this wound, but it's not getting any better. And you come to me, and I just take out the splinter, and in a couple days the wound is healed up. That's kind of how things work here. So some of the things that were interfering with her thyroid function and her diabetes function, asbestos residue. She had tons of antibiotic residues in her tissue that were affecting her. Heavy metals were affecting her. Multiple infections inside as well that she was dealing with. All of those things were able to improve and pull out in her, and that's part of the reason why she got so well. When she had initially come to me, her original goals were be thinner and have less fatigue. That was her 6-month goal. And her 12-month goal was to feel healthier and to be off some medication. So I think we did a good job with that. From 9 medications down to 1. And within a month or 2, she should be even off of that because her blood sugar is within normal range now. Her A1c just has to follow. It takes another 6 weeks or so. A1c will change roughly every 3 months due to the life of the red blood cell. So her fasting glucose numbers, both in the morning and then her nightly glucose numbers, are all within range. So it's only a matter of time until she's able to be off of that, completely off of that medication. She's now able to dance. She loves to polka dance. Was one of the main things that she loved to do, and she's able to do that. So this case was awesome. She's a great patient. She did what she was supposed to do. Some of the things I ask people to do are not easy, especially with diet, but she did great, and she actually is thriving. She loves it. She feels great. No more stomach ache, which was debilitating. Almost all of her symptoms are gone, including the gurgling in her ear. The ear pain is gone. She doesn't have any of that. No more bloating. No more stomach pain. The hot flashes are gone and improved. Anxiety is completely gone. And obviously, when all those symptoms go away, what happens to depression? Depression goes away, because when you feel so lousy, of course everything's going to feel bad. But when you start feeling well again, you're not depressed anymore. She's not fatigued, and life is good. So she was a great case, and now she's done. She will reach out if she ever needs me. But I thank her for sharing her case with me and sharing her happiness with me. But I also am very thankful that she is enabling me to share her case with you, so you can see that your chronic condition doesn't necessarily have to remain that way. It's not a sentence that's with you forever. You can heal. The body can heal as long as we take the splinters out. So that's what I wanted to share. Hope you enjoyed it.